to Parliament buildings, where the Departmental Committee on Health is grilling top management officials from the National Health Insurance Fund. The committee is conducting an in-depth inquiry into the alleged fraudulent payment of medical claims and capitation payments to health facilities facilitated by NHIF. We do apologize for that. Now let's listen in.
Good afternoon to you. Indeed, the NHIF probe continues. Of course, the Departmental Health Committee of the National Assembly, led by NDBS Member of Parliament, that is Robert Pokose, carried on and met with the NHIF members and management this particular morning. It was all about the 8 health facilities that were suspended by the Health Cabinet Secretary, that is Susan Nakhumicha. But a number of issues have emerged in this particular sitting. It has emerged that 11 staff members of the NHIF members were irregularly placed into office from the 1st of September 2020. Now, what we want to get from the chair himself, that is Mr. Robert Pokose, is how much the taxpayers or the members of the National Health Insurance Fund have lost to that particular event. Karibu sana Mheshimiwa, welcome to KBC Channel 1. Maybe the first question, Mheshimiwa, you have revealed something that is very, very egregious this particular morning in your session. You have said 11 staffers were upgraded from various job groups within the National Hospital Insurance Fund. The taxpayers who are watching you right now, you as a member of Parliament, what have you deduced? How much money has the taxpayer lost?
It is running into millions of money that they were irregularly paid. Because you look at once the appointments were irregularly done, and you've confirmed from the chair who has said those appointments were irregular and therefore illegal ab initio. Therefore, it is running into millions of money that after they were irregularly appointed into those positions, job groups, they did a payment, backdating it to a date a date which they had not even been appointed, and therefore we've asked the NHIF that money must be recovered. Yes. Also,
you have been able to establish that NHIF want to procure a new system that is going to cost the taxpayers 4.2 billion, yet the current 1.6 billion is still up and running. What have you deduced from that?
We've asked NHIF that we will call the PS for ICT. We will also call the service providers who are contracted for the system that is running, which was contracted at a cost of 1.6 billion. And now when they claim that they want to overhaul it to put in a new system costing 4.2 billion in an economy that is struggling, then we feel that is irregular and that is misuse of public funds. Therefore, we'll hold them accountable should they go ahead to do that. But we'll invite the service provider who is providing those services to be able, because they are not even able to tell us what service is missing from their audit. And we've asked that the head of the ICT next week on Tuesday will appear here together with the 2 service providers to appear to tell us whether that is in order. Is it to upgrade or is it to overhaul the system? Yes.
And finally, maybe Chair, given that we have to wrap this up, the 8 health facilities which were suspended, and we do understand some of them are up and running, what have you been able to gather, given that NHIF was not coming forth with in terms of the money that has been recovered so far back from those institutions amounting to 6 billion?
We are at the preliminary stage of investigation. Therefore, we are looking at the report. And once the committee we've done the background information, we will also visit those facilities. We'll be able to visit. They are actually not just 8 facilities. There are 67 facilities that have been involved in irregular payments, and those have been flagged out. Therefore, we will be able to visit those facilities, find out what is the real issues on the ground. Because when you look at some of the facilities which we gave there, you saw that there are facilities which in 2021 were getting 29 million. then it is rising to almost 200 and something million within a short period. So what was happening within these facilities? Therefore, and the staff of NHIF who are involved, and also the owners of those facilities that were involved in that fraud. We will also want that once it's established that fraud was committed, then they should be able to be, the government machinery should be able to set in the DCI, the EACC, and be able to have these people prosecuted for the stealing of public funds. Yes.
Thank you so much. That is the chairman of the Departmental Health Committee of the National Assembly, just giving us an overview of what the committee has taken. Now, you do remember the chair has taken two important key rulings: that NHIF should not procure any new system, the 4.2 billion that is supposed to be implemented within 4 phases, until that particular matter is before this particular committee. And of course, substantial reasons are given as to why they want to procure that particular new system. Also, the chair has ruled that the 11 staffers who are irregularly appointed from various job groups all the way to the top management should henceforth stop operating in that particular role until this particular matter is heard in this particular committee. Of course, you do heard the chair has said that he will share that particular report with the Ethics and Anti-Corruption Commission, which is the EACC, the Directorate of Criminal Investigations, DCI as well. That is what we have been able to gather, and of course do expect more in our subsequent bulletins. Back to you.